really pleased now to be joined by a good friend and a fabulous surgeon from Kobe, Japan, Dr. Yuki Okada. Yuki, thank you for joining me.
Me too.
It's good to see you. Good to see you too. You talked this morning at the opening session, and I know you're on the board of both societies, about the concept of international collaboration. It's very important, don't you think, in our learning?
Yes, of course. Not only the so-called the Western country in Asia, in South Asia, and the people suffering from different heart valve disease, and the cardiologist and also cardiac surgeon, they communicate each other in each area, and we have to perform some better treatment for each population, each people.
Right.
Anyway.
In Japan, I know you mentioned this morning that you're beginning to put together a valve society there.
Yeah, of course.
And the concept of the heart team is beginning to come to fruition in Japan.
Yeah, of course. We are going to try to make so the heart team. Yes, it's very important to the so-called transcatheter treatment, surgical treatment. Each one is not perfect. So we have to communicate each other, and we have to make a chance for a patient to select.
Absolutely.
Which one is better.
Absolutely.
There's no perfect solution.
No,
anyway.
And I think by collaborating, the surgeon, the catheter-based interventionalists, everything, it's very important. One of the things that I've been amazed at is that I've been fortunate to have you participate in many valve courses in the United States and abroad. I think that we learn, and I've had the pleasure of coming to Kobe, I think we learn tremendously from each other. In other words, when I'm in Japan, I learn from you and your colleagues and vice versa. And that's really, I think, the strength of this international collaboration, don't you?
Of course. Of course.
We learn from each other. Where, if we looked at valve disease in Japan, tell me a little bit about, is it different than in Eastern countries?
A little bit. Japanese condition a little bit different from South Asia. Looks like a Western country, the developed country, but the patient body size is very, very small compared to those of Western countries.
Right.
So we have to consider the size of prosthesis and size of catheter size, something like that. It's very important.
So it's a difference in size of patient. That's something we don't think about, because you're right. And Japan is obviously a country with tremendous traditions and history. Is it harder for new technology to be accepted in Japan, or just the opposite?
I don't think so.
I don't either. I'm just somebody had raised that question, and I said I don't think that's the case at all. If you looked down the road 10, 15 years from now, for mitral valve disease and for aortic valve disease, where do you think the field will be?
Maybe
in Japan.
Maybe the so-called now the concerning the mitral valve disease, the mitral regurgitation is now extending rapidly. So it's very important to consider the concept of how to repair, what timing is best.
Good.
And for example, for aortic valve stenosis, so the also timing of intervention is very, very important. And the last valve meeting, the patient aged 80 years old and older, most of the patient in Japan, they don't have a special intervention. They refuse any medical.
Really?
That's the history.
Really?
Okay. So, but the minimally invasive or transcatheter and the so-called minimally invasive treatment, developed, those kind of patients may accept. Nobody want to die anyway.
Yeah, no, that's very.
The cardiologist, focus the so-called invasiveness by classical surgery.
Right.
So, if it solves the problem, so many older people accept that.
Yeah, so advances in technique, minimally invasive techniques will make a difference. Well, I appreciate so much all that you and your colleagues in Japan have done to educate us, and I certainly am grateful that you're attending this meeting and have served actively on the board. Thank you very much.
Okay.